from the standpoint of laparoscopic surgery and suturing, it's leaps and bounds better than anything that's available right now, just because of the functionality and the ease of use. It's very intuitive and it works very well. And it allows an expansion of the services that you'd otherwise have challenges providing laparoscopically for patients. Any type of peritoneal flap or mesh placement where you're suturing it into place is an extremely challenging thing to do with just straight stick types of sutures. And this flexibility and range of motion and ability to get into different corners that are otherwise inaccessible expands that aspect. For myself as a foregut surgeon, it allows suturing of the hiatus and repair of the diaphragmatic defect in a far easier manner than just straight sticks.